Hi there, everyone. Coming up on the ACSA Legislative Lunch Break, we'll get you all of your latest news and information from the state capitol and CDE with an in-depth analysis on how it impacts your school community. Plus, Dr. Monica Gandhi from UCSF, the San Francisco General Hospital, will be here to talk about the move from pandemic to endemic, the importance of metrics, and what the impact may be from the governor's announcement next week about masking in schools. The ACSA Legislative Lunch Break starts now. And it is just after 1 o'clock. We welcome you to the ACSA Legislative Lunch Break. I'm Naj Alikhan, ACSA's Senior Director of Marketing and Communications. Welcome. We are so honored to have you with us here on the show. Go ahead and jump onto our chat. Say hello. Let us know where you're watching from. You may wonder where Edgar is today. Edgar is, as we say in television, he's on assignment today. Wasn't able to join us, but we have a big show for you. We have Dr. Monica Gandhi from UCSF. She is going to be here in news headlines, and we'll update you on some programming notes for coming up next week as we prepare for the governor's announcement and updates on masking in schools. Of course, we know that February 28th was going to be the day that we heard more information about the masking guidelines and if there are going to be any immediate changes to it. We'll tell you a little bit about what we've got planned for coming up next week. Want to say hello, Mark Campbell, Jeff Oakes, Mike Hendricks on there, John Moon today, Maria Thompson, Gail Olson is on from Cabo again. Gail Olson, for some reason, is on like the greatest vacation ever, the greatest and longest vacation. So happy to see all of you guys today. Jennifer and Marie, so good to have you. Don Austin, the great superintendent over at Palo Alto Unified with us, and Denise and Deanna as well. Let's go ahead and cover a couple of news topics here before we move on to our guest, Dr. Monica Gandhi from UCSF and the San Francisco Medical Center. Information that you need to know. Of course, it came yesterday. Senator Richard Pan introducing Senate Bill 1479. Now, it would require the California Department of Public Health to work with school districts to develop a testing plan for each school, including preschools, childcare, and after-school programs. The bill, contingent on a state or deferral appropriation, federal appropriation rather, would ensure that resources are made available for school districts to implement their COVID-19 plans. We do have a quote here from Dr. Richard Pan from his news conference yesterday, and if you have some comments about what Dr. Pan is proposing, go ahead and drop those into our chat. We'd love to hear from them. From Dr. Pan, quote, COVID testing plans are essential to parents in schools and childcare sites being confident in staying open and keeping children safe from COVID. Funded school testing plans provide vital information to protect students and teachers through COVID variants and surges. That from Dr. Richard Pan from a news conference yesterday. Again, if you have some comments on that, we have talked a lot on this show about all of the guidance, all of the changes, everything when it comes to masking. It's all going to fall on the responsibility of school leaders. This is yet another one of those things where proposed legislation may fall on the shoulders of school leaders to make sure that they work with CDPH to establish these testing plans. So again, if you have any questions or comments, go ahead and drop those into the chat. Two stories out of LA Unified, and I think it's worth us acknowledging both of these. On Tuesday, the district announced that outdoor masking will be an option for all students in LA Unified schools, including those participating in athletic activities. The district, of course, as most of you are, continuing the masking in classrooms for the time being. But I do want to refer to this story because I am very interested to see how this is working in your school districts as well. This is our friend Kyle Stokes over at KPCC radio station in Los Angeles reporting that the cost of testing students and staff for COVID-19 in LA Unified, that is testing each week, will end up costing the district a projected $527 million, that for testing and contact tracing before the end of the school year. According to Kyle, That is 4 times the amount that the district expected to spend on that. The district has administered between 1 and 2 million tests each month during this school year, which is around 3 times the number of tests they expected to conduct in June. We talked with Superintendent Alberto Carvalho's staff earlier today. The superintendent was quoted in this story from KPCC asking, quote, "Is it still necessary to test at the frequency and intensity that we've been testing given the extreme cost?" We did speak again with representatives over at LA Unified this morning. They are very happy with the progress made on positivity rates there in the school districts and in their communities. But right now, no plans have been established for revisiting the testing policy, which again brings us to February 28th and what you can expect coming up next week, because we do have some programming updates for you. You'll remember February 28th is supposed to be the day where we learn more from Governor Newsom about masking in schools. If news comes out on Monday or any day next week, you can count on us here at the ACSA Legislative Lunch Break to bring you updates. We'll have special editions of the ACSA Legislative Lunch Break on whatever day this information comes out. And then, of course, we'll have our regularly scheduled broadcast, live and interactive, ACSA Legislative Lunch Break, 1 p.m. here. ACSA Facebook and ACSA YouTube. I see there's a comment here from Jeremy Powell. We are not healthcare facilities. We would like to focus on educating students again. Well said, Jeremy. I will paraphrase Jennifer Foss here. We have had a testing site on campus all school year. It is definitely one more thing I am responsible to manage as principal. We have to manage lines, assure that everyone in line belongs there and supports nurses as needed, per our presenters last week. I'm hoping some sort of support in terms of staffing will be identified in addition to conducting notifications. This is a part-time job for me, full-time on some days. Thank you, Jennifer, for that comment. And again, I see Dana Carter, Amy Wynn Hernandez here, Lester Powell. So good to have you guys here on the show. Let's go ahead and bring in our guest. I'm anxious to speak with her today. Dr. Monica Gandhi, Professor of Medicine and Associate Division Chief of the Division of HIV, Infectious Diseases, and Global Medicine at UCSF, the San Francisco General Hospital. Dr. Monica Gandhi here with us on the ACSA Legislative Lunch Break. Dr. Gandhi, it is an honor to have you here on the show. Thank you so much. I know our members have been very excited about you coming here on the show. Let me ask you first, you and some of your colleagues been very vocal about the need for metrics. And have cited evidence with that need to pivot with many of the current COVID mitigation efforts. Tell us a little bit more about the initiatives, but first that importance of metrics, because that is something that is very important, as you have said, to what we're looking at with COVID-19.
Yes. So, I mean, essentially, we're 2 years into this pandemic, and the current metrics, essentially, what do we mean by metrics? We mean that we should be able to relax restrictions and mitigation procedures because things have changed. We have vaccines, we have adult vaccines, we have child vaccines down to 5. Only 28% of parents have vaccinated their children in the country, but we still have the availability of the vaccines, and we have a 73% vaccination rate in the state of California for 5 and above. And so our idea, and we wrote a piece in CNN on February 5th of this year about how to start relaxing measures in schools, is that 2 things. One, for testing, we recommend no more asymptomatic testing in schools. And the reason, and by we, I mean, I wrote this with the head of pediatric ID at the University of Chicago, and where we are going for that recommendation is from the policy lab at Children's Hospital of Pennsylvania, which has been a pivotal organization to help figure out how to get kids back in school and also how to have less burden on the school administrative system. And so the policy lab about a month ago at CHOP recommended no more asymptomatic testing in schools because they did a large analysis at the Massachusetts, throughout the Massachusetts school system, a test to stay program. And they figured out by performing over 200,000 tests that there was very little transmission in schools. If transmission occurs, it's usually outside of the school. So about 96% of the transmission was outside schools, very little inside schools. So because of that, the policy lab recommended no more asymptomatic testing in schools. If you don't feel well, stay home, get tested, but not asymptomatic. And then the second thing that we recommended for masks, because that's the next question, is when can masks stop in schools, is to use a vaccination rate in the community, and not in the school children, but in the community itself, because adult vaccinations protect children. And we proposed a vaccination rate of 70% in the community, which actually our state has already surpassed, and then low hospitalizations in the community. And the CDC is about to update its guidance today on mask guidance, and they're going to use a hospitalization metric instead of a case metric. So hopefully that will allow us on February 28th to have a clean metric for schools.
Let me follow up on a couple of things that you just said. And folks, if you have questions for Dr. Gandhi, go ahead and put those into the comment section. We'll ask those a little bit later on the show. You had mentioned the recommendation for no more asymptomatic testing. And you're saying that a couple of minutes after we bring up that story from LA Unified about, let me just get the numbers specifically here. Testing of students and staff for COVID-19 will cost the district a projected $527 million for testing and contact tracing, which is 4 times the amount that the district expected to spend. When you're saying, no more asymptomatic testing, did the numbers that I just recited to you about what you heard in LA Unified, does that surprise you? And does that have a larger impact on what we're trying to do here in the state with our students and our staff?
Yes, actually, the numbers that you just gave me didn't just surprise me, but they distressed me, because that type of money, instead of feeding that money into asymptomatic testing in schools, which again is not recommended by the premier organization that's looking at school safety, which is the Policy Lab at Children's Hospital in Pennsylvania, that money could be used for other staff support and student support. And do keep in mind that the San Francisco Unified School District has not been doing asymptomatic testing since reopening their schools in fall of 2021. And they reopened in the middle of Delta. They have asked children to stay home when they're sick, and they test children who are symptomatic, not asymptomatic. LA Unified School District has been testing asymptomatic children. And the difference between the two districts is quite remarkable. More children stayed home and were out for quarantines, which puts a burden on parents in the LA Unified School District throughout the fall of 2021 than in the San Francisco Unified School District. And again, I think they kept their children equally safe without doing the asymptomatic testing. We're just talking about symptomatic testing.
Let me get to Dana Carter's question here really quickly, because it does address that asymptomatic testing that you had just talked about. Dana asks, is the recommendation you shared for asymptomatic testing also recommended for staff or just students?
So the Children's Hospital guidelines say for anyone in the school system, including staff. So it's actually going to a model of endemicity. And you brought up this comment about endemic. What endemic means, and I think this is a terribly important part of this conversation, is that you can't eradicate COVID-19. And I think that California, or maybe even the United States, went for more of an eradication strategy before, with masking, distancing, ventilation, contact tracing, and testing prior to the vaccines. What the vaccines gave us the ability to do is prevent severe disease. And our hospitals, as a result, the main strategy to keep people out of the hospital is not just vaccination, but also these treatments that we have available for people who don't respond to vaccination well, who are immunocompromised, and also fundamentally for adults who've declined vaccination. We now have treatments available for them. But the idea that you could eradicate COVID, make it go away from the planet Earth completely, was never actually, unfortunately, biologically available to us, not because we as humans weren't good enough or didn't try hard enough, but because of properties of the virus itself, including the fact that it circulates in animals, in animal reservoirs, so we can never really truly get rid of it. We can't kill all these animals. So because of that, if we can't eradicate a virus, we want to get to what's called endemic management. Endemic management means we live with it. We absolutely prevent severe disease with vaccines. We treat people who decline to take the vaccine. We encourage vaccines and therapeutics, but we don't try to eliminate every single case. And the strategy of asymptomatic testing to try to eliminate any possible case and transmission was more of a pandemic strategy versus an endemic strategy. And most countries in Europe that are at the same vaccination rates that we are have stopped asymptomatic testing with people, only symptomatic testing.
I have to tell you, Dr. Gandhi, the comment section with questions is heating up over here. So we'll get to many of them, specifically to your asymptomatic testing. But let me ask you this. Not a day goes by that we don't hear from one of our members about the school mask mandate here in California. Edgar and I received a couple of emails from superintendents just earlier today about that. As you know, the governor is set to make some type of announcement as early as Monday, which is February 28th. What advice would you give to the administration, to the governor's administration, as they debate what the next steps are?
Well, the advice I would have given them before February 15th is that if you're going to release indoor mask mandates for adults, then have a plan for children as well. Only because I think the flooding that you're getting is probably from two sides. One side is that I don't feel safe with my child not having mask mandates in schools, and that would be a parental and a teacher concern on one side. And the other concern on another side would be people writing in and saying, how come 20,000 people can be in the Chase Center without masks? And my child has to be masked all day in school. I mean, there is an unfair aspect of not having clean metrics for both settings. And it's not actually the governor's fault, it's the CDC's fault, because they have not given these clean vaccination plus hospitalization metrics that we gave in our paper that we wrote on February 5th. And that 70% vaccination rate, because I see a question in the chat, would apply to the census tract or apply to the county. So for example, as you can see, the Bay Area did release their mask mandates for inside settings because they're above the 70% vaccination rate, but not every county in the state has. The 70% vaccination rate would be for the community. And then the hospitalization metric, we didn't actually tell you what we came up with, but we came up with having 10 over 100,000 people in the hospital for COVID, less than 10 over 100,000 people, because the rate of having people in the hospital for flu is 50 over 100,000 in a typical year. And we want to go much lower than the flu because COVID is deadlier than the flu. So we went to a metric of 10 over 100,000 people being hospitalized for COVID in a region. And that fairness would be fair to the population and the schools. And so on February 28th, that's what I would do if I were the governor. And I've already written to the governor and the California DPH and suggested this after we wrote this paper. So it makes it clean. You know the burden of disease is low in your community, and we have the same metric for adults and children in schools.
Do you believe that there needs to be any type of differentiation in mask requirements for children depending on vaccination status?
Well, I don't actually, because what has been amazingly true of the pandemic, and this is just a fact that you can't get around, is that children are much less at risk for severe disease than adults. It's actually a biological aspect of this virus that is not true of any other virus I know. Usually viruses cause illness, severe illness in the very young and the very old, like influenza. But this particular virus spares younger people and from severe disease. And the other thing that protects younger people as we're waiting for the vaccine from 5 and under, we already have the vaccine for 5 and over, is more and more adults around them being vaccinated. So what we saw in the Delta surge in this country is that places like California that had higher adult vaccination rates had fewer children who got very sick than places in the South and Southeast, because their adult vaccination rates were not high enough to protect children. So that 70% vaccination rate, I'm saying, is for the entire community. That would include 5 and above, but I don't think that a child has to be masked if they're unvaccinated and unmasked if they're vaccinated. And I don't believe the CDC is going to make that recommendation today for adult guidelines.
We do have a question that's come in from Gina Lynch, our great board member, I believe, Region 4, which is also the same question that Marie Russell asked. Do you anticipate any changes to the governor's test or verify mandate when we get to February 28th?
Test or verify to either you're vaccinated or you have to test. Is that what you mean?
Yeah.
Well, so endemic management would say neither should those apply. So let's look at the one country in the world that's gone to pure endemic management, which is the UK. They no longer have vaccine mandates, vaccine passports, asymptomatic testing, or mask mandates. That doesn't mean that they're not telling people to stay home when they're sick. They do. And then on February 28th, they're even releasing isolation for when you have COVID. They are going back to 100% normal respiratory pathogen management on February 28th. Other countries are doing it differently. Denmark, Sweden, Norway, Switzerland, Iceland, Italy, France, they're all doing different things. I think that vaccine mandates and passports in the state of California are unlikely to be released from what I heard of the governor's speech when he talked about endemic management. I think that that's still going to be in place, that you have to test or show your vaccine card for a while. And then again, when I think our cases are very low and our hospitalizations are very low, which they are going down and down, then the governor and his California DPH will have to decide when you go back to endemic management. And what does endemic management mean? It actually means normal life for the public. It means that we in the medical care system manage the illness. We manage vaccinations, we manage therapeutics, but the public is not asked to change their life, including showing a card in the future. I don't think the governor is ready for that in our state. I know many countries have done that worldwide who have the same vaccination rates as we, but I don't believe our governor is ready for that.
I had mentioned Dr. Richard Pan earlier. He has been a supporter of vaccinations for some time. But I had mentioned earlier about his new proposed legislation, Senate Bill 1479, about developing testing plans. But let me go back to vaccinations because it's been the biggest legislative issue. There seems to be this fight about student vaccination requirements. Based on your science and the data that you're familiar with, you talked so much about metrics earlier. Where do you stand on this issue right now?
Well, it's a great question. I myself have both of my children vaccinated who are under 14. I also wrote a piece in Time magazine urging parents to vaccinate their children and why. And I encourage you to look at it. And the why that we said was because even though severe disease is much lower in children, if you had a vaccine that could prevent any bad thing to happening to your child, then take it. And I think that these vaccines are safe and effective. On the other hand, because children are so much less at risk for severe COVID, which is just a peculiarity, again, of this virus, and the fact that so many children may not be able to attend school if their parents have decided not to get them vaccinated, I don't believe that children should be only allowed to attend school if they are vaccinated. And in fact, we are the only state that is creating that requirement for the fall school year. No other state has said that no children can go to public school if they're not COVID vaccinated. I would encourage the California DPH to understand some of the barriers that parents have against vaccinating their children, including Black and brown communities who may not trust yet these vaccines, who may not trust the government yet. Understandably, we've had a long history of not doing well in Black and brown communities of creating trust in our public health dictums. And I would allow people to have more time.
Before we get to some of the questions that remain from our viewers, let me ask you about variants. We've gone from COVID-19, then we went to Delta, and then Omicron, and now there's news of another variant out there. What do you understand of this next variant that's out there? And has the work that's been done as far as vaccinations are concerned, do you think that puts us, on a good path to be able to chart these waters with another variant?
Yes. I mean, it will take me just 1 second to explain. the immune system really quickly, but what the vaccines do, or having had natural infection, preferably the vaccines, give you what are called T cell immunity and B cell immunity against all the variants. What changes is your ability to combat the variant with your antibodies. Because, for example, the BA2 subvariant, which is the new variant, that's kind of a sister variant of BA1, but they're both Omicron, it evades some of our antibodies, which protect us up here in the upper airway tract. So there was a big study from Denmark just released yesterday that showed it was very hard, very rare out of 1.8 million infections to get BA2 if you've been BA1 infected, but it wasn't impossible. And the people who got BA2 had mild disease, and they were usually unvaccinated and younger. So it's important to remember the vaccines do protect us against all the variants. They really do. It's just that you may still get a mild infection because the antibodies vary against the variants, but your protection against severe disease is managed down here in the lungs, and your T cells will still protect you against all the variants. So vaccines work against all the variants, and we have not been set back just because we have a new variant.
Okay, so now I'm going to go through the comments section here because we have 3 or 4 questions that have come in while the show is going on. So we'll go a little rapid fire here. Blaine Sigler asks, with regards to the statement on eliminating asymptomatic testing, is that a universal practice, including those students that have positive cases in their classrooms, or for those participating in extracurricular activities, for example?
So the recommendation by the policy lab is to test children who've been exposed. Okay. So it doesn't mean that this is just mass asymptomatic testing, period. If you have no symptoms and you've had no exposure. The test to stay recommendation, that if you've been exposed, you test and you get to stay in the classroom, which is recommended by the CDC, is still recommended by policy lab.
Lester Powell asked, does vaccination status play a role in the testing, be it symptomatic or asymptomatic?
Well, that's a really great question because, for example, we have never tested in hospitals asymptomatically, and neither have we tested, for example, in Chase Center, where people gather. They do have to show their vaccine cards, but there's no testing. So I will say that that's a really great point. What the policy lab, again, and I would recommend people look at their guidelines because they're very clearly spelled out. David Rubin is the head of it, is that they do not recommend asymptomatic testing based on a vaccination rate or a non-vaccination rate. It's no more asymptomatic testing in the setting of schools if you have not been exposed or if you are not sick.
All right, 3 straight here on recommendations. Laura Dutch asked, do you have the same recommendations for adult education setting? We have students 18 to 75. We don't know about vaccination status. Obviously, they don't have to, provide that information necessarily, but do you have any recommendations for that group?
So I think the reason that this 70% vaccination rate in your region and a low hospitalization rate is such a clean way to think about this is that even if you're an unvaccinated 33-year-old, that you have a low burden of virus in your community from those 2 pillars. So what we're proposing, and let's see what the CDC says today, is that no mask, kind of normal, I guess, no asymptomatic testing and no masking if you have those 2 pillars intact. Low hospitalization rate and a high vaccination rate in the community. That means not everyone in your classroom has to be vaccinated.
Brenda Francis asks, what about protections for students and adults who have infant toddlers and infants in their homes? What recommendations do you have for them?
So it's true that infants and toddlers can't get vaccinated yet, and I'm really disappointed about that. And I do think it will take until April at the earliest for us to get that vaccine. The most predictive risk factor during the Omicron surge for children, little children getting sick, was their vaccine status of those around them. So having their older kids vaccinated in the household, having the parents vaccinated, having the teachers vaccinated, this is the best way to keep children safe. In Europe, they never vaccinated, actually not in Europe, everywhere around the world, they never masked younger children less than 5. It was just a World Health Organization recommendation. They said the masking age is 5 and up and not not younger than 5. But certainly in our healthcare settings, we are masking children. I think that's going to become a question for childcare settings. The reason they don't recommend it for younger children, it's hard to keep it on right, and it's very uncomfortable if you use the right type of masks, which are not cloth masks. Cloth masks really don't do much for exposure or transmission. But the best thing you can do to keep your child safe is everyone around them, their bubble, being vaccinated.
Okay. Finally, Don Austin, superintendent over at Palo Alto Unified, says there is a massive disparity between your approach and the CDPH local public health department approach. How can we support and amplify your work?
I actually don't think it's my work at all. It's actually the policy lab. And the reason that I would turn to them as an organization, and I would really recommend the CDPH does the same thing, is the policy lab works in a children's hospital. They're all pediatricians. They're all pediatric ID experts. And they have spent this entire pandemic making recommendations for schools. They didn't actually early on recommend school openings. Then once teachers could get their vaccinations, they did. And they have been changing and updating their recommendations with data as they go along. So it's not me, it's the policy lab. They actually said we could go to mask optional now. Again, I would wait for the metrics to be met. And I would just encourage the California DPH to just go on that website because they know what they're doing. And I really respect them. That's one of the premier children's hospitals in the country.
Dr. Monica Gandhi, professor of medicine and associate division chief of the Division of HIV, Infectious Diseases and Global Medicine at UCSF San Francisco General Hospital. Dr. Gandhi, just looking at the comment section, you are highly popular today. It's been an honor to have you on the show. Thank you so much. Look forward to having you back here.
And I'll send you 2 things for your audience. One is the article we wrote in CNN just 3 weeks ago to spell out how to do things in schools according to the policy lab.
Perfect. Thank you, Dr. Gandhi. Really appreciate it. Have a great rest of the day.
Thank you.
And folks, you heard Dr. Gandhi say in anticipation of an update from the Centers for Disease Control today. Of course, we are working our way towards February 28th. What we expect will be an announcement from the governor after some evaluation about masking in school. So we will have programming for you next week. When we get that announcement from the governor, we'll have a special edition of the ACSA Legislative Lunch Break that day. And of course, we have our regularly scheduled ACSA Legislative Lunch Break live and interactive 1 p.m. Wednesday on ACSA Facebook and ACSA YouTube. Folks, thank you so much for being with us today. Have a great rest of the day, great rest of the week. Edgar will be back with us next week because I'm going to demand that he's here. Have a great day. We'll see you next time.